Thank you, Senator Rodriguez. Senator Campbell, for what purpose do you rise, ma'am?
To ask a question of the author.
Will Senator Hager yield?
Yes, Mr. President.
Senator Hager, correct me if I'm wrong, I don't find anything in this bill that actually puts a wedge between a patient and their physician. As a matter of fact, it seems to me like this legislation strengthens the rapport between a doctor and patient because it asks the physician to have more contact with the patient. Explain more about the procedure. Is that true?
That was some of my points earlier and some of the discussions, especially with the RU-486 medication and also the admitting privileges.
And actually, exactly, asking a physician to be available should there be a complication rather than abandon a patient.
Correct. Yes, ma'am.
So, looking at the TMA, and they rendered a letter, but as a physician that has been a member of TMA, I can tell you this does not represent, for your comfort, does not represent the whole of the association. And frankly, sometimes I think associations, in order to propel their own association, sometimes can't see the forest for the trees.
Understand.
I would say that this bill encourages the patient-doctor relationship because it will improve the care, and that's what they're all about. If you ask them, part of their mission, and it's to improve patient care. The
oath you take.
That's right, and first do no harm. And just to remind everybody how the government does get into medical practice, is something as simple as community-acquired pneumonia. We are dictated what antibiotics we must use to have this standard of practice, best practice act. So we can see the government's involvement, wouldn't you agree, in many things that we practice every day in medicine that you've heard about.
There
right.
are, yes.
Right, everything from getting our medical, our narcotics license and drugs we have to prescribe, who can do that. Government is within, it's just woven within the practice of medicine. So
It is.
would you
Make
say
sure that there's the standard of care in many types of situations.
Yes, and I think that's what the government's tried to do both on the federal level and the state level. I think that's what we're trying to do here. If we see an industry's not regulating themselves for the benefit of the health and safety of a woman, that's what this bill's really trying to do, is it not?
To increase the quality of care, yes, ma'am.
Yes, sir, that's what I thought. Thank you, sir. I
Thanks.
fully support this bill.
Thank you, Senator Campbell.
Senator Hancock, for what purpose do you rise?
A few questions for the author, please.
Will Senator Hager yield?
Yes, Mr. President.
Yes, Senator Hager, it was not my intent to speak today. It's not my preference to be on the microphone on the Senate floor. As Senator Rodriguez brought up, Texas Medical Association, Texas Hospital Association's difficulty or objections to this legislation. Number one, I don't believe we ought to allow any associations to dictate the legislation and the process that we go through on this floor. But I had to question, when I hear of their opposition to the fact of fetal pain, and we talk about fetal pain, it's the description that we've given. As Senator Taylor pointed out, it was my chief of staff who early on in session, early on in her pregnancy, somewhere between 24, 26 weeks, she began to have serious health complications to the point that she was rushed to the emergency room. And much to what we wouldn't want to happen, what we wouldn't want to occur. John Mark was born out of that very difficult situation at 24 to 26 weeks. And these same associations who oppose this bill and who want to deny fetal pain, I found it very interesting. Just a few nights after I was called to the hospital to say prayers with John and Mia, because they were told that there's nothing else the hospital can do to save John Mark. But John Mark survived the night. But there were great complications, heart rate levels, oxygen levels in dangerous areas. One of the things I found unique, and I am not a physician, I'm a senator who loves her staff. Been with my chief of staff for 7 years now. And I love John Mark. But what I saw this this hospital association and these medical physicians who say that there's no such thing as fetal pain would call me in and ask me to come to the hospital. Are you aware why she would need to come to the hospital? Well, his levels were dangerously high. And Senator Hager, they would ask her to simply come to the hospital because the machines weren't working. And what that baby needed was to lay on that mother's stomach and to feel the love and the touch of a mother. And when John Mark felt that love and felt that touch, skin upon skin, his vitals began to improve. And so for weeks and for months, that hospital who doesn't believe in fetal pain did believe, because the evidence was there and I got to see it personally, that when a mother touches a child, that the vital signs improve. More than an incubator, better than a bunch of machines that he's still hooked up on today. Senator Hager, you were that last night, my wife and my daughter and I got a great privilege. You see, at 10 o'clock last night, it was John Mark's turn to have a bath once again. And we got to see John Mark take a bath. And in a few weeks, John Mark's going home because of medical improvements in a state where currently you can have an abortion for any reason at all, up to 7 months. And all you're trying to do this legislation, am I correct, is just to recognize the improvements in medical care and that a child like John Mark is viable up to 5 months. Is that what you're trying to do with this legislation?
But that, as you said, with the touch that child can feel, they can feel that pain at 20 weeks and beyond.
And they can feel the mother's love.
And they can feel that.
Whether TMA and THA want to admit it or not, when that point in time comes and those levels get high, they called me in. Legislatively, they may not admit it, but they called my chief of staff and asked her to come and simply hold her child so that his levels would improve. I'm not a physician. There's a lot of people on this floor, a lot smarter and wiser than I am. But I saw those numbers improve. I saw the loving touch of a mother impact the life of a child. I appreciate you carrying this legislation.
Thank you. And I appreciate you sharing that with us throughout this last session as both of them continue to develop and increase. That was special to hear and watch, and we appreciate that very much. Thank you, Senator.
Thank you, Senator Hancock. Senator Patrick, for what purpose do you rise, sir?
Questions of the author, Mr. President?
Will Senator Hager yield?
Yes, sir.
Thank you, Mr. President. Thank you, Senator. I want to talk to you about RU 486 because that's the portion of the omnibus bill that I carried last session. There was some comments made earlier that it was the first time we actually had that last session.
Correct.
Carrying this session. And I just wanted to walk through to be sure we're in agreement, to be sure the record is clear. The reason we want the doctor to follow the FDA guidelines and the drug manufacturer's guidelines is because if it's a series of 2 pills.
Correct.
If they're taken incorrectly, could lead to serious pain for the woman, correct?
The pill as well as potential side effects, yes.
In fact, if it's not done correctly, she could even become a subject of septic shock,
Yes,
serious infection.
correct.
It could endanger her life.
That's correct.
One of the things that we talked about when you first brought this bill to the floor, and we've talked about since then, is that this bill is about women's health care. It is about improving the safety of that woman having the abortion. And while you're pro-life, I'm pro-life, I wish a woman didn't have an abortion, I recognize it is the law of the land.
And that's the constitutional privilege, yes.
And I also, as a Christian, as someone who cares about my fellow Texan, my fellow man, my fellow woman, is that while I want to protect the life of that baby, we also should be just as concerned about protecting the life of the woman. I value her life as much as the life in the womb. And I believe everyone that supports this bill values both lives And sometimes that's lost in this debate. So in the case of RU 486, the reason we need her to come back to see the doctor is the first pill acts almost like chemotherapy. And it's hurtful to describe it, but sometimes we gloss over abortion. We call it by names, it's not. But the first pill's like chemotherapy. It's a toxin that kills the cells of the baby.
Yes.
And the reason she should come back the second time, 2 days later, is because the doctor needs to be sure that that killer drug, and that's what it is working.
The physician,
The physician,
in case there's complications.
in case there's
Is there
complications.
working? Is there problems?
And if it's not, he may prescribe a different dosage or a different approach. But if the first toxin is working and the cells of the baby are dying, then she has to come back in 14 days, because what that second pill does is flush. And again, it may be gruesome, but this is what it is. This is what it is. It's death by drugs. She comes back in 14 days because that physician must be sure that that baby has been flushed out of her system. And when I hear people stand on this floor or off this floor say that it's not important for that woman to come back and see that physician in a safe environment, when I hear it's not important for the doctor to follow the FDA guidelines,
Who is the most qualified?
who is the most qualified, then those comments are made by people who are not as concerned about the health of the woman, because by then the baby is gone. But if the cells have not been flushed out of her system, then she could have a serious infection, she could have sepsis, she could die.
700% more likely than surgical.
And we had testimony, and I don't know if it was last session when I was on Health and Human Services or this session when I laid out the bill. It's been a long time working on this legislation. But we had testimony from women who were just handed the 2 pills at once and sent on their way. And they reported they were in terrible pain. And they didn't know what to do. They didn't know who to turn to. You know why? Because that doctor was gone. One of the things the sonogram bill did last session. One of the things the sonogram bill did was require the doctor to actually have a patient-doctor relationship. Because before the sonogram bill, we had testimony from Planned Parenthood. The doctor would come in, mask on, just see the eyes, 5 minutes before the procedure, have the abortion, be gone before she was even out of recovery, off to the next abortion clinic. And so those women who testified, they didn't know who to turn to, because when they went back to the abortion clinic or called, that doctor was gone. So the purpose of RU 486 in this bill, and that is the interesting part of this bill, because part of this bill will stop late-term abortions at 5 months. It really is about the safety of the baby, as Senator Hancock so brilliantly and eloquently described, can live. But the RU 486 is really about the safety of the mother, of the woman who was carrying the baby. Because once she's taken that pill, from there on, everything that's in this bill is about her safety. You have done an outstanding job 3 times of being patient, of being honest, of being knowledgeable. And this is a bill that I'm proud, when the right time comes, sooner than later is my hope, to pass. And anyone who says this is not about protecting women's health and raising the level is just flat wrong. and anyone who says this bill is also not about not stopping late-term abortion, because it is about that. We want to save the baby's life, and we want to save the mother's life. Thank you for carrying this bill. Thank you for your work on it.
Thank you, Senator, for all your help. Thank you very much.